The Irving Police Department is the first in Texas to meet all of the requirements of the One Mind campaign as officers focus on how to handle calls involving mental health issues. The department launched a mental health response team a little more than a year and a half ago. We were there for the announcement and learned how the department formed the special team in response to a growing need. Here to talk more about it is Officer Joshua Wright. Thanks so much for being here.
Thank you.
So let's start with the basics. What is the mental health response team?
The Mental Health Response Team is a unit that was developed by the City of Irving Police Department to help combat crisis intervention situations on the streets and then get individuals connected to services after the fact, so that way police intervention is last resort.
What trends are you seeing in the need for mental health services in relation to policing?
Well, with COVID, it has been a rather difficult task because a lot of people have been struck more with the mental illness due to lack of contact with other individuals, the social aspect. So we're seeing a rise in both that and drug usage, alcohol usage. So there's a need for intervention on all three of those behalves. A lot of times those also couple together. Sometimes you'll see drug or alcohol along with a mental illness. And so the need is even more than it used to be back when January, before all this hit. So we need more people on the streets, more officers trained in this. We need more social workers on the street to be able to assist the officers with this, and more teams like ours to be able to combat the situations in each city.
And evidence that the department is taking this seriously. I mentioned the One Mind campaign at the beginning of this. What does that involve?
The One Mind campaign involves the International Association of Chief of Police. They came up with this program that would get all the organizations that they could possibly get their hands on, all the departments throughout various states, to come together under one plan that involves implementing partnerships with mental health organizations in the cities that they work, developing policies that allow them to combat crisis intervention in a meaningful and safe way, and then also giving training to those officers that are on the streets and throughout the department in both mental health first aid and crisis intervention.
You made reference to this, but let's talk a little bit more about it. Your team works with a lot of nonprofits to connect people with these resources. How's that all working out?
It's working out really well. At the very beginning, it was a very difficult learning task because from a police perspective, we're so used to being assertive in these situations, and a lot of this we've had to be patient because everybody's learning. Whenever you have a situation where you have a nonprofit that is there to help, and especially in our role as mental health providers, to be able to deal with these people on the street, it's not like criminal justice where you do a crime and then you move on and then the court system plays out. It's much more patience and a need for supporting behavior between the two of us. So these mental health organizations and the nonprofits and us work together and do meetings very, very systematically and frequently, so that way we understand our individuals and the client's needs, so that way we can get them the best care.
You mentioned this is a tough time. What are the challenges that are still ahead for the mental health response team?
So what we've been seeing is, as we talked before, a trend, an uptick in the amount of calls for service, the amount of people that we come into contact with that need mental health services. A lot of it is due to money, due to lack of insurance. A lot of people are losing their jobs nowadays. And what we need to do is we need to, as a city, we have a good basis for this team, and we understand that that team is doing good work, but we need more. We currently have been in the grant process of getting a second clinician for our team, and then another officer added to our team as well, so that we have two independent, solely working teams that can go and do things. Because right now, as it is, we have two officers on one team and then an officer and a clinician on the second team. We've already run into safety issues because you're only having one officer, and we deal with people that are very volatile in their crisis states. So the more people and the more social workers and the more buy-in we can get to this unit, the more impact it'll have with decreasing the amount of these crisis moments that happen in Irving, and then also getting people the help they need so that they can live the life they want to live.
Taking on this very important issue. Officer Joshua Wright, thanks so much for being here.
Thank you.